A very good morning to all of you. Respected dignitaries, faculty members, and our dear alumni, a very pleasant morning to all of you. Myself, Dr. Sabika Gokul Raj and Dr. V. Vignesh, alumni, feel deeply honored and privileged as we stand in front of you to give you a present surprise and the warm welcome to all the alumni of 2K22 of Vinayaka Mission Sankaracharya Dental College. We would like to take this opportunity to thank all of you for accepting our invitations and taking your time out of your busy schedules to be with us today on this occasion. To look backward for a while is to refresh the eye, to restore it, and to render it the more fit for its prime function of looking forward. College days have always been the best days of our life. They gift us with vivid memories to cherish forever. In the year 2017, we picked up those threads and started the tradition of this alumni meet so that we can weave our precious memories again. An alumni meet is organized to celebrate and refresh our old relationships and form new ones, to get caught up on all that is new in our lives.
This college has given us unforgettable impressions. Those occasional class bunks, canteen gossips, late night studies, hostel fun, life mantras from teachers, culturals and sports fest, love stories, crushes and countless other memories which stay in our minds forever. What an excitement do all those memories bring us. I am sure many of us will go down the memory lanes. Today is the momentous day for all of us as it provides us the opportunity to meet our friends and teachers and embrace the old times. It also enables to notice the changes in development that has happened in the college campus then and now. Looking forward for new interactions and new hopes. We believe that the experiences of this day which you will take home will be worth the time you have all spared.
We would now like to call upon our dignitaries onto the dais with a request to come onto the dais. May I now call upon Dr. Kritika M., Treasurer of the Alumni Association, to occupy the dais. Dr. Maya Ramesh, the Joint Secretary. Dr. B. Shekhar, Secretary of the VMS Alumni Association. Dr. Vail Krishna, Vice President, Alumni Association. Dr. N. Sai Ganesh, President of the VMS Alumni Association. It gives me immense pleasure to invite Dr. J. Sabrinathan, Director of Academics, Vinayaka Mission Research Foundation, and a patron of our Alumni Association to the dais. With utmost respect, may I now invite Dr. Captain S. Gokulnathan, Director of Vivekananda Educational Institution, to come on to the dais.
Let's invoke the blessings of the Almighty. We kindly request you all to rise up for the prayer song. Thank you. Kindly be seated. As a part of our tradition and custom, we would like to start the alumni meet with the lighting of the lamp. May I request the chief guest and the other dignitaries to light the lamp.
We request Dr. Shivakumar Kailasam sir to light the lamp.
Thank you, sir. So now I call upon Professor Dr. N. Sai Ganesh, alumni of 1987 batch, who is currently professor in the Department of Periodontology at VMS DC and the president of the VMS DC Alumni Association, to deliver the welcome address.
Very good morning to all. It's a very golden moment in the history of Vinaya missions and also in the life of alumni students. It's a warm welcome to alumni of 95 batch and other alumni to us. And for us to honor us or honor our teachers, Dr. Google Radhan sir, captain, he came all the way. He is a director of Vivekananda Dental and Paramedical Colleges. To see all of you and bless you, he came all the way from the Tiruchengodu to here. And also our alumni and director of academic VMRFDU, Dr. Sabaranathan sir also came to see all of you. And Dr. Shivakumar Kailasam sir, principal, and he also came all the way from Trichy to see all of you, to bless you all as a teacher. So I am warmly welcome all our honoring guest in the dais and down in the dais, and I am also welcoming the Dr. Bentley and Dr. Karthi, the awardees who came all the way to receive our honor of love and honor of prize to us. And I am also welcoming all my core committee members and my EC members and staffs of this college. Unfortunately, some of them are present due to the DCA surprise inspection, and non-teaching and teaching staff and others. And I am welcoming my students, volunteers who are present here. Thank you for coming and making this function in a big way. It's a very nostalgic moment for all of us. Thank you, sir.
Thank you, sir. May I now invite our young, dynamic and distinguished alumnus of 94-95 batch, Dr. J. Sabrinathan, Director of Academics, Vinayak Mission Research Foundation, and the patron of our association, to come share a few words.
Very good morning to all of you. Honorable Chief Guest for today's function, Professor Dr. Captain Gokulnath sir, my beloved teacher, the President of Alumni Association, Dr. Sai Ganesh, our beloved teacher as well, the Secretary, Dr. Shekhar, Vice President, Dr. Vel Krishna, Joint Secretary, Dr. Maya Ramesh, my fellow beloved teachers, Dr. Shivakumar Kailasam sir, the seniors and my dear friends. Well, first and foremost, I would like to convey my appreciation and thanks for the 95 batch. It's been difficult 3 years for all of you. We understand how difficult it is to gather for an alumni, because we read that in 2019 there were a lot of difficult, painful experiences in collecting. Now, I wouldn't say painful, but it's not easy, as most of our batchmates were in different parts of the world. But it so happens that you planned something in 2020 and the pandemic struck. So we tried to do that in 2021, I mean early part of this year if I'm right, and we couldn't do it because there was a second wave. So but finally we are here, and there's been some monumental effort by most of you to say few words. I guess Stalin, Jay Kumar, all these guys were in touch with us, with the Alumni Association, with the the faculty members, and finally you're here. I know you're all not in full strength what you were planning, but I think this is just the beginning. So it's good that it has happened, and I'm sure this may be your 25th year, and the good news is that you will be soon reaching your 30th year as well. So we see that in the positive way, and I wish you all the very best to have a wonderful meet today here as well as in Yerkad. I believe you're all traveling to Yerkad. I also wish to convey my appreciation to the Alumni Association. For them also, there's been a lot of difficulties. To start with, they formalized this association through the Registrar of the Society, which was not very easy thing to do, and they streamlined the accounts and the banks and the PAN card, etc., etc. It's been very difficult, and all the office bearers, to everybody, hats off for your efforts as well. So whenever we come here for an alumni meet, we kind of want to say a lot of things because we are with friends. This is not a formal occasion. But I don't want to say a lot of things because I believe most of them would be nice if we share that in a more informal way. I think we have a lot of time until the evening. And probably partly for the reason that some of them may not be able, we can't probably able to say on the stage as well, our friends. So I don't want to take a lot of time and space from the organizing batch. I think this is your day. This is the day of 95 batch. So with this, I wish you all the very best, and I really look forward to enjoying this function. All the best. Thank you.
Thank you, sir, for your wishes. The world is full of diamonds and gems, and we are having some of them here today with us. To build this event, you were all an integral part of this Vinayaka fraternity. Without your glorious presence, this event wouldn't have been possible. We would like to recognize each one of you by honoring all of you. As we read out the names of the alumnus who are present here, you kindly come forward to collect your mementos. I request the chief guests and the other dignitaries to present the mementos to our alumni.
Dr. S. Santosh from the batch of 2010. Dr. S. Santosh. Dr. K. Hari Krishnan from the 1996 to 2001 batch. Dr. Shanmugasundaram. Dr. Shanmugasundaram. Dr. A. Stalin from the 95-96 batch. Dr. V. Chitra from the 95 batch. Dr. Padma Priya. Dr. Charles Durai from the 95 batch. Dr. Krishna Kumar from the 95 batch. Dr. C. Rajshekhar from the 95 batch as well. Dr. Deepa Lakshmi from the 2004 batch. Dr. P. Prabhakaran. Dr. G. Bhaskar. Dr. Seran K. from the 95 batch. Dr. A. Lakshmanan. Dr. S.R. Murugesan. Dr. B. Kanagasabapati. From the batch of 95. Dr. Mohammad Aslam Khan from the batch of 97. Dr. Mohammad Mustafa. Dr. G.S. Ashokan. Dr. Geeta G. Dr. G. Shivakumar. Dr. Ananta Lakshmi. Dr. Rajesh, sorry. Dr. R. Arun. Dr. Raj Shekhar C. Dr. N.S. Naveen Raj. Dr. Elavarasan M. Dr. Nikhil Kumar Jain. Dr. M. Arumukam. Dr. Mano Christian Igalo. Dr. K.S. Sasikumar. Dr. M. Ghulam Muhammad Jilani. Dr. Jahir Din. Dr. Meena Durai. Dr. P. Maragadam. Dr. M. Jayakumar. Dr. Beena C. Matthew. Dr. Sushil in the batch of 95. Dr. Joshi Jacob. Dr. Robin. Dr. K.E. Selvendran. Dr. M. Balasubramanian. Dr. G. Jayasudha. Dr. P. Thangapandi. Dr. S. Deepa Lakshmi.
Health Minister, Dr. Vijay, and given the responsibility of serving the director of Vivekananda Educational Institution, and we are happy to have amongst us, who's been a part of our institution for nearly 18 years, a great academician and an administrator. I would now like to call upon Professor Dr. J. Sabrinathan to present a memento to our chief guest. Thank you, sir. With utmost happiness, I would like to call upon our chief guest, Dr. Captain S. Gokulnathan, to share a few words.
Good morning to everybody. So I could recollect my entry into this institution in 1988. That time, Dr. P.K. Bhaskar, my professor, he brought me here to meet the chairman, our late chairman, Dr. Shanmugasundaram. And the same day, I got the appointment and I joined the institution. Almost 18 years, I spent in this institution. But those days, you must be knowing the public health dentistry, a new subject, having no textbook, no guidelines, no syllabus, But nobody wants to take the responsibility to teach public health dentistry, where there is no textbook for public health dentistry. And with the help of some youngsters like Dr. Kumar, Dr. Shai, and Dr. Rajarajan, we manage the department. And luckily, every time the inspectors visit the institution, they will all the time they appreciate the public health department. We maintain the records and we conducted camps in and out Salem, and it is a routine process that we used to conduct camps outside the city. And probably one of the alumni, Dr. Arumugam, must be knowing, even Madurai we conducted camps for 3 days, Pudukottai, and even Karaikal, Nagapattinam, Thiruvannamalai, it's a routine camp every month. Like a break, we all will go there with our boss, Dr. Shivakumar. He'll maintain a good team. So evening they will enjoy. But morning 7 o'clock, the military discipline. Everyone should be with a proper coat and suit and tie, They should report to Dr. Shivakumar for camp work, That was the system. I was very happy regarding my stay here, But I left Vinaya Missions just to take a new venture, Because Vivekananda College, they tried to get the institution for probably from 96 to 2006 they tried, but they couldn't get the approval from the Ministry of Health. So that time, just like that I went there, They approached me and I went there, and maybe it's all God's grace, or some luck, The 10th year we got that approval, That may coincide with my entry, that's all, I didn't do much of activity those days, But then I decided, purely women dental college. But the Vivekananda institution is exclusively for women. Almost 25,000 women students there in the campus, the largest women campus in Asia. So we had some difficulty to cope up with the girl students, highly sensitive. But they are good at academically, they are good, but highly sensitive. No teacher can shout, no teacher can repeat the work, Immediately we will receive the complaint from the parents, not from the students, But now they realized, after analyzing the results, now they are all happy. And I am very happy to see my students, everybody is doing well in that field, in that place. I could hear about them. But luckily we are meeting everyone in one place So that way this alumni meet helps us. And also we have a good guide like Dr. Shabri, very enthusiastic leader, and Dr. Vel Krishnan, and Dr. Sai and Shekhar and Maya. So everybody is good doing the job to keep you together, So kindly continue this trend and maintain it, and always remember that Vinayak Mission is the foundation for your wealth, for all your developments. So you can build up towers, but foundation one should not forget, that you keep it in mind. Whenever you get a chance, you repeat your gratitude to the institution. That's my personal request. Thank you for giving me this opportunity. Once again,
Thank you, sir. As we had missed a few names from the 95 batch, please come to the dais and collect the memento. Dr. Deena Dayalan from the 95 batch. Dr. Bandana. Dr. Bandana from the 95 batch. Chief, sir, please present the memento, sir. As we had missed out a few names, sir. Dr. Vasanthi from the 95 batch. Dr. Maheshwari from the 95 batch. Dr. Sushil. Dr. K. Keetnashri. Dr. G. Maheshwari from the 95 batch. Dr. C. Rajshekhar from the 95 batch. Thank you, sir. Dr. K.C. Keetnashri. Thank you, sir. Thank you, sir. An institution's fame rests not only on its administration and teaching staff, but also on the achievements and developments of its students. Many of you hold key positions of the major influence in the society, not only in dentistry, but in various fields, and have excelled in their respective fields. Our college and the management have decided to recognize and appreciate the efforts of such alumni and would like to honor them during the alumni meet. Now I request Dr. Maya Ramesh, Joint Secretary, to brief about the Professor Dr. P.K. Bhaskar Award and Professor Dr. P.K. Ramalingam Award and introduce the awardees of the same.
A very good morning to all the dignitaries present on the dais and off the dais. I will be briefing you all about Alumni Achievement Awards today here. VMSDC Alumni Achievement Award is presented under two categories. One is academic and the other one is non-academic category. There will be a selection committee constituting of patrons and senior faculty of the college. Alumni Academic Award. This award is instituted in the name of Professor Dr. P.K. Bhaskar. Professor Dr. P.K. Bhaskar was the first principal of VMSDC and became director of Vinayaka University. He was an old student of Madras Dental College and has worked as professor in Madras Dental College. Guidelines for the award. The candidate to be considered under the academic category should have been attached to a college or university for a considerable period of time, at least more than 5 years. The candidate should have a good professional track record. The candidate's achievements will be weighed against the criteria formulated and will be verified by a team of faculty. If there is no application in a particular year, award will not be given to anybody. For this year's award, the first call letter was sent on 30th September 2021 and second letter was sent to all alumni with a deadline of submission of CV as 20th November 2021. The soft copy of the curriculum vitae and the achievement proofs should be sent to vmsdcalumni@gmail.com. There should be a minimum of 100 points to be selected under academic category. Those who apply for the award should not be a member of the selection committee. In case of tie of marks, age of the candidate will be considered and the older alumnus will receive the award. The decision of the selection committee will be considered as final. An alumnus once selected for the Alumni Achievement Award cannot reapply or be reconsidered for nomination in the future attempts under any circumstances. I hereby call upon Dr. Bentley George, Vice Principal Administration and Associate Professor and Head, Department of Public Health Dentistry, Pushpagiri Dental College, Medicity, Perenturutti, Tiruvalla, who will be receiving this year's academic award, to come forward and be seated. Now I take the privilege of welcoming our chief guest, Captain Dr. Gokulnath, and patron Professor Dr. J. Sabrinathan, Director Academics, VMR of DU, to honor Dr. Bentley George, and I request all other dignitaries on the dais to join them. Dr. Bentley George graduated from Vinayaka Mission Shankaracharya Dental College in the batch of 1999 and completed, just wait now, let me read out. Okay. In the batch of 1999 and completed his post-graduation in public health dentistry from Savita Dental College. He is a PhD guide in Kuhas University now. He has completed a certificate course in Health Science Education Technology by Kuhas and Advanced Dental Leadership Program for Dental Professionals from UK. He has completed numerous certificate programs in addition to these. He has more than 35 publications in indexed national and international journals. He has 2 funded research projects, one by Kerala government and other by ICD. He has published numerous oral health awareness articles in Care magazine. He is an author of a book titled Oral Health, All You Need to Know. The book is a complete book on oral health for awareness for the common man. He is co-author for the textbook Essentials of Public Health Dentistry by Soben Peter, Arya Publishers, in the year 2021. He conducts seminars for interns all over India on the topic What After BDS, and he was a guest speaker for our interns also. He has numerous awards to his credit. Dentist of the Month by IDA, Mumbai, IDRR Golden Tooth Award for the Outstanding Young Dentist, Most Proactive Junior Academician, Guidant Award in Public Health Dentistry, and Rao Memorial Awards are few of them. He was organizer and resource person for many continuing dental education programs and conferences. He has attended numerous conferences and other dental education programs. He is a reviewer in many national and international journals and is a member in numerous committees of Pushpagiri Dental College. He is a member of Indian Association, Indian Dental Association, Indian Society of Dental Research, and Indian Association of Public Health Dentistry. Let's honor Dr. Bentley George. The award in the non-academic category is initiated in the name of Professor Dr. P.K. Ramalingam. Professor Dr. P.K. Ramalingam was principal of VMS DC. After Professor Dr. P.K. Bhaskar, he was an eminent oral and maxillofacial surgeon, and gradual progress in academics in VMS DC took place during his period. MDS inspection in 5 departments were initiated during his period as principal. Guidelines. The alumni to be considered under non-academic category should be in general dental practice. Those who were never attached to a college or those who were attached to college for less than 5 years will only be eligible for this category of award. The candidate should have a good professional track record. There should be a minimum of 50 points to get selected under non-academic category. I hereby call upon Dr. Karthik Shanmugavelu, who is a dental practitioner from Chennai, to kindly come forward and be seated. He will be receiving the prestigious Professor Dr. P.K. Ramalingam Award now. Now I take the privilege of welcoming our chief guest, Captain Dr. Gokulnath, and patron Professor Dr. J. Sabrinathan, Director Academics, VMR of DU, to honor Dr. Karthik Shanmugavelu, and I request other dignitaries on the dais to join him. Dr. Karthik Shanmugavelu completed his BDS from Vinayaka Mission Shankaracharya Dental College in 2004 and MDS in Oral and Maxillofacial Pathology from Ragas Dental College in 2020. He also completed Master of Science in Experimental Oral Pathology from Barts and London Queen Mary's College of Medicine and Dentistry, University of London, UK in 2007. He has a diploma of membership of Faculty of Dental Surgery of Royal College of Surgeons of England and Faculty of Dental Surgery of Royal College of Physicians and Surgeons, Glasgow. He has received scholarship from Tata Trust, Medical and Healthcare, and Cryonas. He has fellowship from International Board of Medicine and Surgery, USA. He is a member of Australian Society of Implant Dentistry, Independent Medical Practitioners Association, American Dental Association, and Indian Dental Association. He has membership in Hellenic Archives of Oral and Maxillofacial Surgery Journal. He is an editorial member in 5 journals and reviewer in numerous journals. He has a book published on Behçet's disease and has more than 70 publications in national and international journals. He has attended numerous dental education programs, seminars, workshops, and conferences. He has numerous presentations, both poster and paper, to his credit. He has 5 dental clinics in different parts of Chennai and has a diagnostic center in Krompet. He is a multifaceted personality with clinical research and publication skills. Let us honor Dr. Karthik Shanmugavelu. Thank you all.
Thank you, sirs, and hearty congratulations to the awardees. The main objective to organize this event was to provide a platform to the passed out students to relive their moments and cherish their old memories associated with their friends, teachers, and their alma mater. The 95-96 batch is celebrating 27 years of togetherness. To rekindle the nostalgic moments, let me now call upon Dr. Rakhi Panikar of the 95-96 batch to take over and share their experience with us.
A very good morning to the blessed dais, all my gurus assembled here. My great salutations on behalf of 95-96 batch for being with us, for taking all your time to be with us. I think it's a blessed moment, feeling very overwhelmed and so happy to be here after 27 long years to my alma mater, to the very foundation who made our foundation, and standing here all because of your blessings and your advice, which paved us to be the wonderful dentist we are today. Our very respected principal, the Alumni Association Director, President, Secretary, my dear seniors, Dr. Shabri, all the association members, my very respected sir, Dr. Shivakumar Kailas sir, Dr. Baby John, Dr. Sai Ganesh, Dr. Shekhar, my very respected Dr. Maya Ramesh, who we spoke in the beginning regarding the alumni. As we all know, this virus, COVID, blocked us in our homes, and we all were dumbstruck. Like, was it the end of the world? Was dentistry coming to an end? Because it's there in the nasopharynx and we are the people dealing into the oral cavity. What are we going to do? Are our aerators going into rest? Are the clinics coming, shutting down? We were all in a big peril, what to do? But anyway, I think it's because of God's grace and because our alma mater has helped us to deal with whatever you come, whatever may happen, you should go forward. They made us so strong that whatever situation, we should face it, we should face the challenges. That's how our professors paved us and we graduated from this wonderful foundation. So even though COVID broke our alumni get-together last year and we planned it in January, now we are back here, 95-96 batch, though not in full strength. Most of us, we could make it, and it's really, we had lots of good memories and bad memories. I think life is like that. It's weaved out of good and bad, but definitely it made us what we are today. We have so many successful dentists in our batch, and it's all thank you, sirs. Thank you all due to your blessings and the grace you've given us. You've been praying for us. You have scolded us, but we've understood it's all for the good. And wherever we went, we could stand out. We all have come out shining in different fields of life, be it as college professors, be it abroad. We have many of our students, batchmates working abroad. They could not be here with us, but I think we are viewing it through Facebook and online this thing. So I take this wonderful opportunity to thank the management, the principal, the staff, and especially the Alumni Association. They have taken so much of pains to contact each one of us, to contact all our batchmates, so that this reunion could be made possible. I always think, just like a mother's love, just like our mother, she teaches us the ABC of life, the values of life. Similarly, when we came here, just as a pass out from school, just after 12th, they nurtured us and they made us into a beautiful graduate of dental surgery. They kindled the passion of dental surgery into us. We didn't know anything. We didn't know why we were mixing plaster of Paris, what impressions we were taking. Our models were thrown out. What proximal wall, what pulpal floor. We didn't know anything till finally we reached the final year. And but I think that all that torture and all that, it really paved us, and that is how and really that is how now we could set up clinics and we can manage any kind of patients. We know how to manage them because that's how tough our professors made us. So I take this opportunity to thank all my professors and this wonderful foundation. And of course, a thank you is not enough. We have a very small token of appreciation for all of you, my gurus, a small token of appreciation, a memento and a shawl to honor you, and a certificate to just remember and cherish this wonderful time we spent together, so that you remember each one of us, because we always do in our daily practice. Whenever we see a patient, whenever we do any treatment, we always remember our professors, what they taught us, how to handle it. So thank you. So please accept this memento on behalf of 95-96 batch as a token of our sincere gratitude and appreciation to each one of you. I call upon each one of you, and our batchmates will do the honors. First, I call upon our very respected, esteemed Dr. Gokulnath sir to please receive the memento. I request Dr. Seran to please come forward. Dr. Seran, please come forward. Lakshman. Dr. Lakshman also. Both of you, both. Please honor Dr. Gokulnath sir. Thank you, sir, for all the guidance and support you've granted us throughout our life in Vinayaka Missions. Thank you so much, sir. All your blessings. Call the person who is giving first. Okay. Next, I invite Dr. Padma Priya to please come forward. Dr. Padma Priya. I humbly invite Dr. Shivakumar Kailas. Sir, please come and receive our honor. Dr. Anantu. Thank you, sir. Thank you for coming all the way from Trichy to be with us. Please accept this memento and honors. Next, I call upon Dr. Manu. Dr. Manu, please come forward. Dr. Manu and Dr. Kanaga Sabhabadi. I invite Dr. Sai Ganesh. Dr. Sai Ganesh, sir, please receive the honors. Thank you, sir. Thank you for all the guidance you've given us. Your blessings always, sir. Thank you. Next time with Dr. Charles and Dr. Ashokan, please come forward. Dr. Charles and Dr. Ashokan. Dr. Shekhar, sir, I humbly invite you to receive the honors. Dr. Jayasudha, I request Dr. Jayasudha and Dr. Maragadam. Dr. Jayasudha and Maragadam, please come forward. I humbly invite Dr. Sendamari Kannan. I humbly invite Dr. Sendamari Kannan to please receive the honors. Next, I invite Dr. Meena and Dr. Chitra. Please come forward. With great pride, I call upon Dr. Reena Baby. Dr. Reena ma'am. Thank you so much, ma'am, for being with us. You were such an inspiration always for us. Ma'am was the soul of surgery department. I still remember how we managed syncope. Thank you, ma'am. Thank you so much. It's a pleasure to be with you. Dr. Krishna Kumar and Dr. Arumugam, please come. Dr. Krishna Kumar and Dr. Arumugam. Next, I warmly invite Dr. Prabhakaran. Dr. Prabhakaran, I humbly invite you, sir. Please accept the honor, sir. Next, I invite Dr. Maheshwari. Dr. Maheshwari and Dr. Deenadayal. I humbly invite Dr. T. Gokul Raj, sir, to please receive the honors. Dr. T. Gokul Raj. I invite Dr. Arun and Dr. Deepalakshmi to come forward. Dr. Arun and Dr. Deepalakshmi. I humbly invite Dr. M. Bhaskar. I humbly invite Dr. M. Bhaskar to receive the honors. I humbly invite Dr. M. Bhaskar to receive the honors. Sir, please, it's a humble request, sir. So please, Dr. G. Bhaskar. Dr. G. Bhaskar, I am extremely sorry. Sir, Please, it's a humble request. Please receive the honors on behalf of 95-96 batch. Next, I invite Dr. Sushil Irali and Dr. Robin Akara. I humbly invite Dr. Dhanakoti. I humbly invite Dr. Dhanakoti, sir, to please receive the honors on behalf of 95-96 batch. Modalities, that is how it has turned us into the caring dental surgeons that we are today. Once again, I take this opportunity to thank you from the bottom of our heart on behalf of 95-96 batch. I invite Dr. Sushil to share a few experiences. Dr. Sushil, the stage is all yours. Thank you once again.
Good morning, one and all, respected, esteemed guests on the dais. My dear friends, when I think of our college, I would put it as a bittersweet memory. Started off with a bitter way because after I finished my 12th, I had no clue as to where to join or anything. So first of all, from the bottom of my heart, I would like to thank our chairman, Shanmuga Sundaram, sir, for having formed this college so that we had an opportunity to study here. So thank you, sir, so much. To my dear teachers for making us what we are in whichever possible way. And dear friends, seniors and juniors for giving us lovely memories. Thank you so much. See you all.
Next, I request Dr. Arumugam to share his experiences.
Second thing, looking at the teachers, we have variety of moments. As Raki said, we had both good and bad. But what we are today here in front of you is only because of you. There is no doubt. You have made our life meaningful. As they said, Shivakumar Kailasam sir, he has made us a perfectionist. He will make you work again and again to give you the best. What utmost you can give, he will try to extract from you. And remembering about Goganathan sir, I remember once he said to me, I can say that not even a single street in Salem has been left without our campman being there. He made it sure that each and every part of Salem has been covered. Not only Salem, as sir mentioned, after completing my course, I called from Madurai, sir, can you come for a camp to Madurai? He said, for how many days, how many students do you want? That's what he asked. We fixed the date. He came with the team. He served for around 1,700 students and people. That was a magnanimous achievement. We have Reena baby ma'am here. When I was in third year, I was trying to put a suture on a patient's mouth. She came close to me. She asked me, "Are you a house surgeon?" "No, ma'am, I'm in third year." "Then how can you suture for this patient? You are not supposed to do no." I said, "Ma'am, I'm trying to learn." She asked everyone who were there in the department, "You come close." She said, "What you are doing is correct. You are trying to learn, but how you are doing is wrong." She sat in front of the patient. She taught us how to hold a needle holder, how to put the suture, how to give angulation, how to give force. She never thought that this third year student is making an over exaggeration. She tried to make us learn. Not only her, just imagine the stalwarts, starting from Navanidhi Krishnan sir, Vadivel sir. They are like giants. Wherever you go to Tamil Nadu, if you are saying that I'm a student of Dr. Anita Simon ma'am, they will say, "Okay, you have learned from a master." That's true. Actually, if ma'am has been here, we would have been very delighted, but due to her health reasons, she is not here. Then talking about my seniors, now they have become huge. Dr. L. Krishna, Dr. Savari, but not in size, sir. We have become very large in size. But they have been so kind to us. Really, sir. Sir, when you got graduated from the 99, I think, you gave us a treat, and that was one of the memorable moments in my life. I can never forget. So the seniors were so kind to us. Regarding my batchmates, everybody will say when you are going to college, you will make friends. But let me tell me from my heart, I have got so many family members for my side. There are so many people who have become a part of my life. Whenever I'm in distress, I can call my friend and say, "Macha, I have this issue. I'm having this problem." When I'm having a happy moment, I would first like to share to my friends because they have become an integral part of my life. So this college has given me knowledge. This college has given me courage. This college has given me friends. This college has given me family. What else I can ask for? This alma mater has given me everything, and what I can do is I can take the blessings from this college. Thanks for all. Thanks for giving me this opportunity. Thank you.
Next, I invite Dr. Muhammad Mustafa to share his experiences.
Good morning, dear doctors. Thank you, alumni. Thank you, sir. I don't want to take much time. கற்களாக இருந்த எங்களை சிற்பங்களாக செதுக்கிய எங்கள் டாக்டர்ஸ், எங்களுடைய குரு அனைவருக்கும் என்னுடைய நன்றியை தெரிவித்துக் கொள்கிறேன். I want to share only one thing. நிறைய பேர் சர்ஜரியில் இன்ட்ரெஸ்டாக ஹவுஸ் சர்ஜன் பீரியடில் ஒருத்தர் ஒரு இதில் ஒர்க் பண்ணுவாங்க. சர்ஜரி நல்லா ஒர்க் பண்ணுவாங்க, எண்டோவில் ஒருத்தர் ஒர்க் பண்ணுவாங்க, எல்லாருமே ப்ராஸ்தட்டிக்ஸில் ஒருத்தர் ஒர்க் பண்ணுவாங்க. நான் அதிகமாக டைம் ஒர்க் பண்ணது வந்து கம்யூனிட்டி டென்டிஸ்ட்ரி டிபார்ட்மெண்ட் தான். ஏன் அப்படின்னா எனக்கு டாக்டர் கோகுல் சார் இருந்தாங்க, நான் ஒரு சார் பின்னாடியே சுற்றுவேன். கம்யூனிட்டி டிபார்ட்மெண்ட்டில் தான் 2 months இருக்கும். மற்ற டிபார்ட்மெண்ட்லாம் 30 days இருக்கும், 45. அது என்ன கம்யூனிட்டி மட்டும் 2 months வைக்கிறாங்க. அதை நான் ரொம்ப நல்லா யூட்டிலைஸ் பண்ணிக்கிட்டேன். சேலத்தில் நான் இருக்கும்போது சாரை வச்சு நிறைய டிவி ப்ரோக்ராம்ஸ் கண்டக்ட் பண்ணேன். ஜெயிலுக்கு நிறைய கேம்ப்ஸ் எல்லாம் கண்டக்ட் பண்ணோம். இந்த மாதிரி நிறைய கேம்ப் பண்ணதுனால இன்னைக்கு காட்ஸ் கிரேஸ் ஒரு 3 டென்டல் கிளினிக்கு, 2 டெர்மட்டாலஜி கிளினிக்கு, ஒரு காஸ்மெட்டாலஜி கிளினிக்கு, ஒரு ஜென்ரல் ஹாஸ்பிட்டல், இதெல்லாம் பண்ணுற அளவுக்கு என்னை வளர்த்து விட்டாங்க. ஸோ பற்களால் நான் பற்களுக்காக நான் அப்படின்னு சொல்கிற அளவுக்கு எங்களை வளர்த்து விட்ட எங்களுடைய டாக்டர்ஸ்க்கு எல்லாத்துக்குமே தேங்க் பண்ணிக்கிறேன். தேங்க்யூ வெரி மச் சார். தேங்க்யூ. எங்களுடைய சீனியர்ஸ் சபரி சார், வேல் சார்லாம் அவ்வளோ ஒரு க்ளோஸாக இருப்பாங்க. இன்றைக்கி வரைக்குமே ஒரு சீனியர் ஜூனியர்ன்ற மாதிரி ஒரு இல்லாமல் அவ்வளோ ஒரு இன்றைக்கி வரைக்கும் நல்ல ஒரு கனெக்டில் இருக்கிறாங்க. தேங்க்யூ டாக்டர்ஸ். தேங்க்யூ வெரி மச் சார். தேங்க்யூ.
The stage is open to any of our batchmates. Anybody wants to come forward? Anybody? We just have this one golden opportunity. Anybody wants to share your experiences 95? Yeah, Dr. Lakshman, of course. Please.
I don't want to take much time, but there are few memories I would like to recollect upon the stage at this point of time. The distinguished teachers and my friends present on stage have given me a life which I can portray at its very best level on the community where I am present. Vinayaka Mission's founder, Mr. Shanmugh Sundaram, he planted a small seed in the city of Salem, and I do not know in what manner and which thought he planted that seed at this place. But now, along with this college, the city of Salem has grown limitless. And today, Salem is hosting a chief minister, a future chief minister for Tamil Nadu. It is that kind of place that we are cultured into. So I'm happy that I am an alumni of VMSDC. The unique nature of an alumni is that you can go back to it at any point of time without an appointment and just walk into the college and tell that I'm an alumni of this institution. They will warmly welcome you, respect you, and treat you to the best and send you back with happiness. தாயின் கருவறையை நான் கண்டதில்லை, ஆனால் என்னை மனிதனாக உயர்த்திய இந்த கருவறையை எத்தனை முறை வேண்டுமானாலும் நீ வந்து வசித்து விட்டு போகலாம். எத்தனை முறை வேண்டுமானாலும் உன்னை யாரும் இங்கே நீ யார் என்று கேட்க மாட்டார்கள். உனக்கு எந்த ஒரு ஐடென்டி கார்டும் தேவையில்லை. நான் இந்த கல்லூரியின் மாணவன் என்ற ஒரே ஒரு சான்று இருந்தால் மட்டுமே போதும். நீ இந்த நாட்டின் குடிமகனாக நீ என்றைக்குமே இருக்கலாம். நான் கடமைப்பட்டிருப்பது எல்லாமே திரு சண்முக சுந்தரம் அவர்களுக்கு மட்டுமே. ஏனென்றால் அவர் விதித்த விதை இன்று ஒரு விருட்சமாக மாறி நம் நாட்டின் மொத்த மக்களையும் இங்கு ஈர்க்கும் சக்தியாக இது திகழ்கிறது. என்னை மனிதனாக மாற்றிய இங்கே இருக்கும் அனைத்து நல்லுள்ளங்களுக்கும், என் ஆசிரியர் பெருமான்கள் அத்தனை பேருக்கும் என் நன்றியை இன்று உதித்தாகிறேன். தேங்க்யூ.
Any of our batchmates would like to speak? So I think we can call it an end. Once again, from the bottom of our heart, we deeply appreciate the wonderful opportunity this our alma mater, our principal, management, and the Alumni Association Director, President, Secretary, our wonderful seniors, Dr. Shabri and Dr. Velukrishnan. All our sirs, we deeply appreciate you. Thank you so much for giving us this opportunity. And also, I would like to say that I think because of this harsh training we received, I and my husband, we practice in Ochara, Kollam, and we had a second clinic in Kollam, and we got the NABH accreditation on May 5th. So I'm so happy to share this wonderful news. We are the 6th dental clinic in Kerala to receive the NABH accreditation. So I would like to share this wonderful news with all of you. And once again, I thank you, all of you, from the bottom of our heart, 95-96 batch, for bringing us together under this wonderful roof. Thank you.
Thank you, 95-96 batch. Hope it is rekindled your inner spirits. Next, we'll move on to the oration. And before we move on, we have a few instructions. We kindly request all the alumni to fill the alumni and the curriculum feedback by scanning the QR code which is placed just near the registration desk. So it's a kind request from our side, from the institution, to kindly fill in the feedback forms on the curriculum and the alumni feedback forms. Next, after the function of 95-96 batch, or we request the spouses and the children to move on to the community department, the new one, where you had your breakfast in the morning for entertainment. Over to 95 batch.
We would also like to take this opportunity to extend our contribution to the Alumni Association. We would like to hand over the check to the President, Secretary, and Treasurer. Please receive this a small token of our love and appreciation to this foundation. in the form of a check contribution to the Alumni Association. I request Dr. Lakshman, Dr. Stalin, all our batchmates to please come forward and hand over the check to the Alumni Association. Please come forward. Come. Yeah, we'll come down, sir. Yes. Yeah, we'll stand down. I request all the batchmates, 95-96 batch. This is a share of our contribution to the Alumni Association. Yes. I request the representatives Dr. Stalin and Dr. Lakshman to hand over the check and the batchmates can assemble. So that, it does. So that will be a motivation to each and every student. We'll stand down. I request the coordinators to please stand on the stage and the batchmates can stand down. Okay? I signed. Come. You please come. Salinum, Lakshmanum, Deena, Dr. Deena. Come, you all stand and hand over. I think our batchmates can assemble in the front. Please assemble in the front of the dais. Yeah, please stand in a row so that everyone is seen. Behind. I think some of you all can come on stage. Half of the people can come on We also heartily congratulate the award winners. Thank you so much.
I wish to thank the 95 batch for the contribution on behalf of the university as well as the institution. You can be rest assured in whichever way you wish to disperse this fund, it would be respected. And I believe there will be some committee members from your batch also to oversee that. We will make sure it has been done. Thank you very much. And just to share a good news, which I probably thought I should have said in the beginning, our university have just obtained the A grade in the NAC accreditation. We thank all of you for your support, and we need a lot of inputs and cooperation from alumni as well. So I just want to convey that as well. Thank you very much. Yes.
On behalf of Alumni Association, as a president to my core committee, thank you very much for this kind and thankful gift from you. This can be utilized as per your words. Thank you. Thank you so much.
We wholeheartedly thank the 95-96 batch for this kind gesture. In order to recognize the dedication and sincerity of Professor Dr. Sarama Matthew, who's been a full-time academician throughout her career at VMS Dental College, the Alumni Association has decided to give her an oration in the name of Professor Dr. Sarama Matthew. May I now request Dr. Vignesh to introduce the oration speaker, Professor Dr. Reena Rachel John.
Thank you, ma'am. Professor Dr. Reena Rachel John has completed her undergraduation in the year 1991 from the Government Dental College, Goa, and went on to pursue her post-graduation in oral and maxillofacial surgery and completed in the year 1995 from Tamil Nadu Government Dental College, Chennai. She is a fellow of the Indian Board of Oral and Maxillofacial Surgery from 2020. She has completed her PhD from Sri Ramachandra Institute of Higher Education and Research in 2020. Ma'am has served as the President of Tamil Nadu AOMSI in the year 2020. She was the Chairperson of Institutional Ethical Committee in KSR Institute of Dental Sciences in 2021, a PhD Supervisor of VMRF DU, Doctoral Committee Member of SRM Institute of Higher Education and Research, and also a reviewer of the Journal of Maxillofacial and Oral Surgery. She has got more than 30 publications in various national and international index journals, authored a chapter on local anesthesia in the textbook of Oral and Maxillofacial Surgery for Clinicians, and has 2 ICMR grant-supported research projects. To add another feather to the cap, she has been awarded the Vinod Narayan Researcher Award by the Tamil Nadu AOMSI in the year 2020. It is my pleasure to invite our Professor Dr. Reena Rachel John, currently the Associate Dean Research at VMSDC, to deliver the Professor Dr. Sarama Matthew oration on the topic Strike a Balance, an Oral Surgeon's Perspective. Thank you all. Welcome, ma'am.
So, very good afternoon to one and all who are here
It's been an awesome experience just sitting for some time here and listening to Raki and her company regarding their, their experiences. Before I start off my oration, I would like to acknowledge the alumni office bearers and the chief guest, Captain Dr. Gokul sir, and all of you for having given me this opportunity to deliver the Sarama oration. You don't know how emotional it is to see your students after 25 years, or a little more than 25 years. We are celebrating the 95-96 batch, I understand. We've had 2 years of COVID, 2.5 years of COVID, and no physical gatherings. So many things coming into, flooding our minds that makes us very emotional as teachers. So before I start my oration, as it is Dr. Sarama Matthew's oration, I remember Dr. Sarama Matthew as a very gentle person. I understand that she is the first woman graduate from Trivandrum Government Dental College, went on to do a post-graduation from Nair Dental College, and then retired from our institution after 20 years, almost 20 years of Can you hear me? Yeah? Almost 20 years of her teaching experience in our institution, and then she has even, her association with our institution must have been so good that she has inspired her future generation to take on dentistry in our institution, and that is about Dr. Sarama ma'am. So it is a privilege to deliver this oration in her name. And yes, we are celebrating the 95-96 batch. I don't have all the names out here. I got this list from Dr. Maya. And from this list itself, I understand what luminaries you guys are. There are people as Raki said, there are people abroad. There are people here who are heads of departments, And this batch is so close to me because, sir, Dr. Gokul sir, 95 was the year when I joined this institution after my post-graduation. So, I'm a little senior to you, but we seem to have traveled the years together till now. And thank God that we are here together, hale and hearty, celebrating each other, and it is a privilege to deliver this oration. So I applaud every luminary who's sitting here and all those who are not here from the batch of 95-96. I just want to go through my journey, because when I go through my journey, I think I will take you guys through your journey. I come from Goa after doing some schooling, my college and my undergraduation. And at the age of 24, when you're in that marriageable age, Goa, as you can see in this picture, so colorful, sun and sand and beach and wine. By destiny, because when you are 24, you're marriageable age, your parents decide where you have to go. I was dropped in Mettur. Mettur, again the land of water, only it is not sea, it is river. And you can see the difference, a colorful past to a gray and white present. Dr. Shivakumar is looking. Now what is she saying? Yeah, so that's how my journey was. And then when I was put there, I was wondering why God put me in a place called Mettur from Goa. Because when I was in Goa and when I was doing my undergraduation, my colleagues and my teachers always thought that I would go abroad and I would do this and I would do that. And then I found myself in Mettur, and a place, actually I couldn't get the old pictures. This is from Dr. Chandramohan, your junior, I think, Chandramohan from Mettur, yeah? So senior, yeah. So he gave me some pictures, but that was a place where I saw people in Komanam and all that, and I said, wow, what's this place? And then my husband says, you come from a place of bikinis, so this is nothing worse, okay? So then life is not about finding yourself, But it is all about creating yourself, I think. You know, you need to create yourself. You need, for the younger ones who are here, we've all traveled through that. I'm just taking you through that, but I see some young ones here. For them, I'm saying you should imagine your life and then you create your life that you have imagined. That is what I think is life. That is why I think, though I was put in Metur, I'm here talking to you, and there are a few faces who know me somewhere here and there when we go around. So my dream, what was my dream when I was 24? I wanted to do my best at whatever I do. That was one of my dreams. And I wanted to be in a position to help wherever I could. And I wanted to be known as a good oral and maxillofacial surgeon. And when, Dr. Raki and there was one more person who, I forgot his name, my age, sorry, who said that, I contributed a little bit to their knowledge in surgery. My eyes just filled with tears. I'm an emotional person. I was happy that somebody recognized that I could do some surgery. So this is my priority at that age, 24. I had 3 children, yeah, one of which was a very difficult and is a very difficult child, but I had 3 children and they were my priorities. That is why, though I had done my post-graduation and passed out in 95, it took a long 30 years to actually be recognized as a maxillofacial surgeon in my specialty, whether it was in the institution, in my place, or my association. So that's how I placed my priorities. So I think you have to close that. And this is my belief. I believe in God Almighty's guidance in my life. Many a times when I am down in the dumps, I'm sure all of us know that life is a swing, and it goes from one end to, it's like a pendulum, it goes from one end to the other. When you're happy, there's another moment when you're sad, So all of us go through ups and downs, and when I'm down, I always am on my knees, which is the best place I feel that I can be, at the feet of God. So that is my belief, and that is how I have gone. So this is our clinic where you can see that always my better half is surrounded by people, always surrounded by people, and having a lot of help for him, because I guess it's because he is used to that kind of fasting. And I'm always a loner, working alone, of course, earning less, because I have gone from a time in 95, 96, you remember? There were people coming for extractions. And I used to be so happy doing extractions, because I could do that better than him. So it satisfied my ego. But then gradually, 2010, 12, 2020, I'm phased out. Nobody wants an oral surgeon who can do extractions. They want oral surgeons who can. I heard one of the alumni saying, I have dermatology clinic. It's a dental spa we're talking about, cosmetics, dental surgeons doing cosmetics and things like that. So I was phased out, and therefore I am a lone dental surgeon, right? And unfortunately, even my blades started getting replaced. My husband wanted to show me that, I can do what you do with laser, and I am from the 90s, so I had that mind block of trying to learn technology, especially when it's slower. With a blade, I can make a cut like that. With a laser, he will sit like that and go down. I don't like that. And so I think that was I would say it wasn't a good thing. It's always nice to adapt to technology. And now I want to, take you through some of the instances during a very few, just bits and tits and bits there I don't think I can educate any of you guys, because I know you guys have 3, 4, 5 clinics and you're all like prosperous people. I can't believe that you are the guys who sat during my lectures. Final year would have been my 4th year of experience as a teacher. And you were sitting in my class there, young, naive, fresh faces, trying to absorb what I'm trying to tell you. Now you can tell me, looking at that experience in each of your faces, I know I can learn so much from all of you. I'm hoping that we will interact and get to understand the journey that you have gone through. I'm just giving you a glimpse of a bit of what I have gone through. So here, why did that happen? Why did that happen, Diana? I'll go that way. Okay, so I'm just going through some of the cases, which were misdiagnosed. This was one case which came with a swelling like that. You can see that reddened area in the posterior region. And this person came to me saying that, I went to a lot of clinics and they said, you go to an ENT surgeon because of that red and swollen, posterior pharynx. It's not in the oral cavity. And therefore, this person came to me saying, Madam, what is my problem? I don't understand because I went to a lot of dental surgeons and I can't understand my problem. So then we just asked a few questions. I don't know if that video works, and you can make out from that video that her voice is like a hot potato in her mouth. All right, and she's saying that I had a hoarseness of voice since the last few weeks, in addition to the pain and the swelling. Her mouth opening is not really reduced, but it's only the hoarseness. And she says that if she lies on her back, she feels that breathlessness. It's relieved when she's, when she lies on that side. I don't know if you can hear that. Can you play the video? No, I don't think you can hear it. Okay, never mind. Never mind. Never mind. It's okay. So basically, that's why I wanted to. No, the video is. I'm wondering. I have another very interesting video. I hope the audio can be heard. I'll make it 100 then. See. Okay, so what she's trying to say is I have a difficulty in swallowing, I have a difficulty in breathing when I lay on my back, it's relieved when so when I heard all this and I saw that impacted tooth there which is infected, I knew that that could be the cause for, so it was just a matter of opening the mouth and examining, which would have come up with, brought the right diagnosis. Can you put it on screen show, please? I would have been happy if I had my laptop. My laptop? Another thing is, as dental surgeons, we forget to identify small telltale signs like this and the stains there. And as dental surgeons, I think we are in the forefront in oral cancer. Oral cancer is, unfortunately, one of the highest on the health burden. It is the third most common disease that is causing death globally. So just identifying a small lesion like that and seeing those stains there and counseling the patient is also part of our responsibility. Another case of misdiagnosis. This young girl has gone to 4 clinics with that swelling. And each one gave, because she's a nice chubby girl, a swelling so far away from from the oral cavity. And she was told it could be a parotid abscess, it could be a parotid tumor, it could be tuberculosis. And they went through a lot of investigations. I just took an OPG and saw this carious tooth there, and then I said, could that be the cause? But why so far away? And then I did an aspiration and I got pus, and that was for sure. And that's the pus I got when I incised and drained. And that's how she was. There's no scar at all, in spite of giving an incision on the face in a fair young girl. And then went on to do a space maintainer. So how balanced we need to be, in our approach. So here, when I'm talking about diagnosis, I also want to tell you that I was at the midcoms yesterday and day before, and Dr. Rajashekaran from Ganga Hospital, the orthopedic surgeon, he was talking about balance again, work-life balance. So why am I talking about striking a balance here? Actually, today we are striking a balance between the dental inspection and the alumni meet, the DCI inspection and the alumni meet. Life is always like that. We need to strike a balance. We can't get very focused on one thing and say, I'm only going to do this. We have to open out our scope and say, I can manage this and this and this. That is how all of you are successful, I'm sure. This is another case of misdiagnosis. If you look at his mouth and his radiograph, you will see that he has lost a lot of teeth. He came telling me that, I have this fistula there, or he said there's that dimple there, from where there's pus coming out very often. I go to the dentist and the dentist say, I have to get one tooth removed, the next tooth removed, the next tooth removed. And that way he got all these teeth removed. And still he has not been relieved of this complaint that he went for initially. And when I took the OPG, I saw this small radio opaque structure, and I said, why can't that be the cause for the, the pus that is coming out? Why don't we address that? So I opened up, I just gave local anesthesia, opened up, and there was a sequestrum. I removed the sequestrum, did a excision of the fistula, sutured up that intraoral wound, and that's how he healed. He was so happy. So it was just a matter of focusing on something that is so minor. This was another case of misdiagnosis. This lady had the swelling again here. Many times when the swelling is there, we think of parotid. We need to think of the smallest and the most common before we go to the rarer diagnosis. So here this lady came to me very worried because she said she was told this is a parotid tumor. It could be a cancer. And always, especially after COVID, I think the health issues have been so high that people are worried that they are going to get cancer because mucormycosis, black fungus, people are worried that they're going to be affected with something. That kind of fear psychosis has got into a lot of people. I don't know if you have come across such patients. So this lady also had that psychosis. What I did was I palpated, it was tender and it was soft, so most probably it's not a tumor. Then what I did was, because it was not warm or did not show any indication of a vascular lesion, I just aspirated and there was pus. Sent her for an contrast CT and I saw this. There was a cavitated, you can see that, right? Hypodense area there, right? In the parotid gland. So it was a parotid abscess only, not a tumor. And just put her on medication, on antibiotics, and she was fine. So that is the importance of asking the right questions, looking for the right signs, and doing the right investigations, understanding the investigations, and doing the right treatment. This is another case that was very interesting. No role for a surgeon as such, but then even a surgeon should know when not to wield the scalpel. So this boy, this was a young man who got married just 3 days before his visit to my clinic. The night after his wedding, he went to his wife's place, and his wife's place, the parents, when the husband comes to the wife's place, what do we do? All our parents want to give the best for the men, right, Gokul sir? Correct, sir? Gokul sir? That's right. So what happens is, this man's father-in-law and mother-in-law treated him to a lot of seafood, and this was allergic stomatitis. He went to 2-3 clinics. You know what was given? Gels. Put Dolo gel CT, put Dento gel. It wasn't going down. So he came to me saying, what is wrong with me? I just got married and I have this problem. He came to me, I think, on the 5th or 6th day after the incidents. So I asked him what happened. So he said, I just got married. All right. And then what happened? So, I went to my wife's place. I'm staying at his wife's place is Salem. And then I asked him, okay, did you have any medicines that were different? No, I'm not having any medication. Okay, what is it that you had differently in terms of food? And that is when he said, I had a fantastic feast with seafood. So I said, oh, seafood? Do you always have seafood? And then he said, no, I don't have seafood usually because I usually get some allergy, some itches. So I said, could that be an allergy then? Are you allergic? So when you asked a few more questions, then he remembered, oh, maybe I'm allergic to seafood. And that was how he was. And he was in pain. You can imagine the pain because of all these ulcers, no? You can imagine the pain because of all these ulcers. I just put him on medication. What would we put on? Steroids, right? Just 20 milligrams of Vizolone, and then the topical application. And the 1 day post-medication, he was like this. He came back to me and he said, wow, what did you do that? It was just a matter of diagnosis. And just that one question, which was a simple question. It wasn't an academic question. Where did you go? What did you do? How, what did you eat? Those were the simple questions. That was 1 day post-medication, and that was 1 week post-medication. That was how he healed, right? Now, this is another case. I don't know how many of you come across TMD. Yeah, I'm sure the incidence of TMD is coming more. Yeah, a lot of you are shaking your heads. And depression. I think the mental disease is higher than the physical disease now. This is a young lady who was on antidepressant drugs, right? Went to a lot of dentists and with this, with this problem. Can you see that ulcer? It's not very well seen. Can you see that linear ulcer there? There's an ulcer there also. Very painful. I couldn't retract because it was very painful. But just by the looks of her eyes, I could make out that she was not a very happy person. So the only question I asked her was, are you on any medication for anything? Are you not happy about yourself? And immediately she opened out and she had tears in her eyes, and then she said about her drugs. And this was just an allergic reaction to the drugs. And again, put her on medication, and she healed very well. Now, why have I put this? I'm an oral surgeon. Should I be doing periodontal pathologies? If I say that I will not, yes, we do have specialists coming and doing, but sometimes you may not get them because they may be busy with their own work. So you should be, equipped enough to understand that you can also do something like that. So this was a case where there was a furcation involvement, and me being an oral surgeon, I could take a symphyseal graft with a bone drill, and then pack it there, and that was the result of the furcation involvement 1 year post-op with a good bone formation. So just because we specialize does not mean that I will be only this. We should learn to apply our knowledge for the benefit of another person at that particular situation. If you have a specialist who can come and help you out, well and good. But if there is no, it's good to help out. Principles of minor oral surgery is always something that is dear to me. How you identify, what approach to take. This was a case of an impacted canine, you can see here, and there were some root stumps there. This was a case where, again, the root stumps were removed and the patient was left back. So again, just an OPG would have helped the person understand there's an impacted tooth, where this patient was complaining of a salty fluid in the oral cavity. Raise a flap and remove the tooth with least damage to the adjacent structures, and suture it well, and you have a good bone healing. And that was the kind of tooth. And when do you do an odontectomy? Many times you don't need to remove the tooth in toto. You can section the tooth and remove. That's not wrong either, right? Now the concept with impacted third molars, I'm sure all of you know, is if it is close to the nerve, it's okay to cut and just remove the crown. I'm sure all of you know that. Leave behind the root, nothing wrong, because it's better to leave the root behind than to have a numb lip, right? And use of technology. As I said earlier, I'm a person who is a little on the back foot with technology. I don't know if it is because I started practice in 1990s, but it's always good to be updated with technology. Using technology, empathizing with patients, not just telling them that it's only a needle prick, flashing that needle in front of them and then going and jabbing, because you see the needle every day, but the patient sees the needle only once. That would be the first time, and you will have a syncope, as somebody said, So why do you need to manage an emergency? Why don't you empathize with the patient and give them a more comfortable jab? That would be better. And this, I think, you all must be doing like scores of them. I just thought for the younger ones, I can see a few of them there. I think they are my interns who are sitting there. Yeah, for them, the importance of giving incision, clean incisions, not jagged incisions, clean incisions, and raising a good mucoperiosteal flap so that your periosteum does not tear off, and cutting the bone in such a way that that's a clean cut, the distobuccal, right up to the distobuccal and distolingual bone removal, and then odontectomy if required. You can see that there, an odontectomy if required, so that you don't have to remove more bone, because obviously bone is more precious than tooth. And then delivery of tooth. Yeah, and as I said earlier, if you have a tooth that is close to the inferior alveolar canal, it is not wrong to cut. And if you see another person's Other person's, no water? No problem. Feet, right? So it's important for us to understand. Sometimes, we're not sure of it. So when you see an X-ray with a root there, what will we say? Oh, I think that surgeon, dental surgeon, has left a root behind. Thank you. So that's very important for us to understand. So clean surgery is very important because the way you treat your tissues, the tissues treat you back. And I'm sure all of you are successful surgeons, dental surgeons, because of the way you treat your patients, your co-employees, which are also very important. So that's how we strike a balance, right? So suturing and wound healing. This is another case where you can see the impacted supernumerary tooth. Again, palatally placed. Why have I put this here? Because you can see that there is a crowding there, and this tooth is here between this, right? And you could have just left it there. It's asymptomatic. But why are we thinking of removing it? Because the orthodontist has asked for us to remove for orthodontically aligning the tooth. And therefore, the raising of the flap so that you get good visibility and accessibility, approaching the the supernumerary tooth, removing minimal bone so that you don't destroy the adjacent tooth and bone, and removing with the right instruments, and see the bone that is removed. Very minimal, not destroying the adjacent tooth. Very important. Striking a balance there too. And suturing in such a way that you do not have a hematoma or dead space in the palatal aspect. This is another case where we had a palatally impacted canine, and the approach is similar, and again, sectioning of the crown, that is important when you are removing. So it is not heroic to remove a tooth in toto. Heroism is not what is important. What is important is how safely you are going to deliver your treatment. And updating knowledge. Yes, all of you know my age, I'm sure. At least you will calculate it. Plus your age. So updating knowledge does not have an age. There's no age bar. I did answer that exam. There's no foul play. For my implantology program, my husband said, you do not do an implant till you do a Nobel implant, any implant program. So I had to answer the exam. I had to pay for my implant program, though I was doing it in my own institution. My PhD program was at the age of 50. My FIBOMS was an exam orient. So what I'm saying is there's no age for doing your education. When I listened to Dr. Rajshekharan yesterday, orthopedic surgeon from Ganga Hospital, what he told us was, during his chief guest address, was that his father at 79 got his PhD, and he was the oldest PhD, the oldest person to get a PhD at that age in the university. Ganga Hospital chairperson. Raja Sabapati sir's and Dr. Rajshekharan sir's father. So I think age is no bar to update your skill or increase your knowledge. And that is why today I can confidently place an implant in my clinic. And implantology, I realized, is not only for, from a surgeon's perspective, but also from a prosthodontist's perspective. So I had to understand occlusion. I had to understand what are all these what is this jig and what is, all that. And for a person who has a mind block on technology, okay? So what I'm saying is if I can do it, all of you have done it, and all those who haven't done it will do it also, right? And that's how we have got the occlusion, the implant supported prosthesis in place. So understanding the prosthetic space that is needed, and understanding when the prosthetic space is not sufficient, and therefore advising an endodontic treatment for the opposing tooth, because you need to speak about all this initially itself to the patient. You can't see it and then say, okay, I will put an implant, and then after you put the implant, say, oh, there is no prosthetic space, I have to do an endodont. Then the patient is going to get wild with you. So we need to pre-plan before we actually deliver the treatment. So that's the implant in place, endodontically treated lower tooth and crowns in place. Patient very happy. Another patient who was very, very, very scared to put get an implant in place, but got the implant done. And then she says, now nobody can recognize that I have an implant-supported process. I know that Bentley and all are doing a lot of implants, and he must be laughing at my work, but Bentley, at 50, I've started this work, right? So another case where an oral surgeon would say, why don't we remove the 8 and 7 and then put the implant, But then here again, I thought I could place an implant, and though there's an inclined 7, right? So the patient was rehabilitated in that way. Now, all these principles of minor oral surgery that we do in our dental clinic was the basis for me to do major surgery like this. Now, when I put the slide here, at 19, say they are a dedicated lot and would love to teach whatever they know from their heart. So this was possible only because I could believe in myself and keep saying I can do, because I've not been trained in oncology. I've not been trained, not gone abroad and got my training, right? I was put in Metur, got attached to Vinayak Mission Shankaracharya Dental College. Today, my DCI inspector asked me, how long have you been here? I said, sir, I'm married to this institution. And then my husband says, oh, she's my wife. Oh, why didn't you tell that earlier? My husband never says that. So, so that's the thing. Despite that, no, I'm not from a big place. I'm from a very small place. But I believe that I can do. Why? And why? Why? I used to ask my God, and, why do you bring these oral cancer patients in front of me? Why do you? When I see that suffering of that patient, I'm like, I'm throttled forward to wanting to help, because that was what my dream was. I wanted to be in a position to help, So that is what drove me to do what I'm doing now. And if I'm recognized by Moni Abraham Kuriakos, I met him yesterday. If he can call me, Reena, how are you doing? That must be because of some work that he has seen of mine. So that was one of my dreams. Remember, I wanted to be known as a good maxillofacial surgeon. So dream, that is important. Dream, that is important. But striking a balance, that is also important. As Dr. Raj Shekran was talking about yesterday, work-life balance. He put 2 videos. He put a video, the usual YouTube videos of a Friday night, when the penguins are jumping all around, showing that, I'm going to have a weekend next. And then the Monday morning when the white bear is like crawling and, oh my God, Monday, So he was saying, is this what is work? Does work have to be so bad? No. And what he said was, any successful person has one thing in common, whether it's Sachin Tendulkar or, Bill Gates or Steve Jobs, there's one thing in common. They have a passion. They have a passion for their work. And that is what makes them all successful. We can't have all fun and believe that we can be successful. I don't think that's possible. That would be like, imagine all of us only being on the beach and having fun and going to the disco, and who's going to do the work? Right? Who's going to bring up the children? No? Who's going to get all the things in order? Yeah? And who's going to give us the money to have that fun? So work is not all dead. And he was saying, my father at 79 can do PhD, then what about you young guys? And I thought that was huge. No? And then he said, the young ones of these days say, YOLO, you only live once. He says, you live every day, you die only once. And so, trying to strike a balance from my side, it is my family and my
much as we have learned everything. You know, cry together, laugh together, everything. Thank you so much for VMSDC for that. And for all us, sorry to say whether I talked it as torture, but today I find it as a blessing. You've taught us and we face it really well. If you come across something, oh that, it's not as bad as that which we had in Salem, I can go through this. My AC is not working. It's not as bad as the heat in Salem. It's okay. My kids will come and ask, Mama, how do you bear with all this? You need to go to Salem and find out. That's all. That was a school for us. And you know, I sometimes talk like a politician. So they're like, how do you know this? You need to have friends, you know. You need to get over, learn from them, you know, good, bad, all this. Oh, so this has been your life and your teacher? Yes, I would say yes. So thank you so much.
Thank you, ma'am. Now may I call upon Professor Dr. J. Shabrinathan, Director of Academics, Vinayaka Mission Research Foundation, to present a memento to Professor Dr. Reena Rachel John.
Since Dr. Reena John just gave an oration, I mean, sometimes you just go back to nostalgic experience and you remember certain things. And I just remember this. See, when we were in our final year classes, like there were a lot of wonderful teachers. I still say that we attended the best lectures. But there is one lecture we have no choice, but we have to be attentive. I'll tell you why. At the end of the lecture, when we come to the next lecture, the lecture starts like this. Now let us just revamp the previous lecture. You know who the lecturer is? Dr. Reena, madam. So much so that I actually implemented that when I was a teacher. That's how, you know, you learn from your teachers, and which was very effective. Whether the students like me or not, whether they like the way I teach or I speak or not, but they have to listen to me. In the end, it is they who get benefited. I believe it is we who got benefited. I just remember this, madam. Thank you very much. There's another one. I'm not going to reveal the name because I don't know whether it's live and it could be posted in the YouTube. There was a video which was to be, she was just showing that, is this the way? I remember there was one candidate, there was one student who extracted the wrong tooth. I'm not going to reveal his name. So I could see that. Unfortunately, it was not the student's mistake. It was another faculty's mistake, and I could see what happened after that. So I thought I just remember that as well. Thank you, madam. Thank you for, she was just mentioning that it was her first oration, and we are it's our honor that we give the oration from us in our alumni meet. Thank you very much.
Thank you, sirs. We are towards the end of our inaugural ceremony of this alumni meet. I would like to call upon Dr. Vail Krishna, the Vice President, to deliver the oath of thanks. The oath of thanks will be followed with the national anthem, and then it will be given to the AGM.
A very good afternoon to all. It gives me immense pleasure as an alumni and Vice President of VMSDC Old Student Associates to deliver the vote of thanks today. On behalf of VMSDC Old Student Associates, I would like to extend heartfelt thanks to our chief guest, Captain Dr. Gokulnath sir, for gracing the occasion and honoring our awardees. I express my sincere thanks to Director Academics, Patron, VMSD Old Student Associates, alumni of 94 batch and my guidance for the growth of our alumni. I would like to thank Associate Dean, Research Professor Dr. Reena John Madam for delivering Professor Sarmas Matthews' oration today. I'll be failing in my duties if I don't extend my sincere thanks to all our
Okay. Yes. Friends, please. Roshan, come on.
எவ்வளோ நேரம் இன்னும்? ஸ்டாலின் எங்கம்மா? ஸ்டாலின் வருது பைக்.
Kind attention please. Good afternoon my dear. Please, AGM is going to start. Please all of you sit. And office bearer, please come to the stage. I request Vice President, Treasurer, Secretary to come to the stage. Joint Secretary. And I request Patron Dr. Sabrinathan sir to guide this thing as observer. I request all of you to please sit down for the AGM, please. If you want any post, please climb for it. It's open for you.
Booklet sign होंगे. Good afternoon, everyone. We are going to start our AGM 2022. I am to read out the agendas. First agenda and from 2021 to 22, we have lost some valuable alumni. Vivekanandan from 1986 batch, Chandramohan 1986 batch, Matthew Cherian 1990 batch, Varalakshmi 1990 batch, Rishi Shoot 1993 batch, Shivakumar from 1995 batch. So I request everyone to give 1 minute. Thank you. Now I am going to read out the annual reports 2021 to 22. For the next office bearers, we have selected some people. I am just reading out. Pattern, Dr. Sabrinathan, Dr. Baby John, Advisory Committee, Dr. Shekhar, Dr. Sai Ganesh, Dr. Saravanan, Dr. Rajkumar. Committee members, that is President Dr. Vel Krishna, Vice President Dr. Maya Ramesh, Secretary Dr. Priya, Joint Secretary for anybody from your batch, Jai Kumar from 1995 batch. Right. And Treasurer Dr. Sapita Gogolraj. Executive members Dr. Arun, Dr. Sarama Mathifen, Dr. Anita, Dr. Narendran, Dr. Vignesh. Anybody to be included in that? We need 5 more.
I'm very glad that it has been discussed in a very friendly manner. It is just a suggestion from your batch, from 95 batch, we need some representation in the EC. We'll be very happy because you can guide the next batch how to conduct the program. So please feel free to give the names. And also, we need a representation from 96 batch in EC. 96 batch, it has been done, no? It has been included. And also from 93 batch, because next year they are celebrating their 30th year. Am I right? 93 batch? Dr. Priya? Yeah, so you have your representative. Please add, you're there. Please add Dr. Kamaraj also as executive committee member. Dr. Kamaraj, executive committee member.
So other members are Stalin EC la varangila EC la Dr. Murugeshan, no. So Dr. Rajmohan, Dr. Arun Kumar, Dr. Diana, Dr. Pradeep, Dr. Kamaraj, and Dr. Murugeshan, Dr. Lakshmanan. Can through in EC? Any other agenda to be discussed?
Yeah, from 1995 batch, we want to make one resolution. Actually, we have given that check leave for 1,50,000. This amount is particularly for top academician in first year of our VMSDC in every year. So we have to put this amount as a fixed account. So from that fixed account, we have to collect that interest rate. That interest amount will be given as a award for topper in the first year VMSDC batch in every year. So it has to be conducted in every consecutive year. So maybe in your college function or in your alumni association function, we can hand over this amount as a cash award to the topper. So that is the motive behind this check 1,50,000. So we want to make one resolution. So the criteria that has to be fixed like that, and it should not be used, this fund should not be used for any other purpose. So this is the thing we want to make. For that, we would like to ask one thing from you. You have to form a committee. So, for example, we can form that 4 members in that committee. The first one can be dean of this VMSDC, and the second one may be the association secretary or the president. And other 2 members has to be selected from our batch, from 1995 batch, so that we can supervise whether this award is going to a particular person, whether it is correct or not. So every year, if you want to change that members, then we can ask you. So according to that, you fix this committee, and this resolution should be made in our AGM now. So this is the thing. Yes.
First of all, again, we welcome this. We thank the 95 batch for that. Yes, there will be a committee to be formed, headed by the dean. Both the secretary and the president will be there in that committee, always, so that it becomes very easy, and 2 members from your batch. In terms of, like, I believe you're giving this award for the topper in the first year, right? Yes. And the name of the award? You can tell. Okay. So what you do is that in principle we are approving, I mean we are asking the members for the approval for this, right? And also like the criteria for the winner, we have a similar structure in our institutions, because we are giving a lot of other awards for the finalist students, for overall toppers. That would be the same criteria, but it is only for the first year. So the criteria would go accordingly. So anything else you want to add? That I think that is fine. So and more importantly, this award will be given during the academic excellent award function of the institution. So we will notify your batch at the earliest, so that your batch representatives can be on stage when this award is given for the first years. Fine? Okay. Fine. So all these things, please note it down and make sure it is covered in the meeting minutes, and the meeting minutes have to be sent to all the members. Right.
Thank you. Thank you.
Any other agenda? Okay. So, okay. AGM is urgent.
எல்லாருமே